First, I want to say a big thank you to everybody that's involved in making FHIR a reality. I know it was a lot of hard work. We have a lot more work to do, but you've made an incredible impact on the future. I'm really encouraged about the future of healthcare and FHIR. I sometimes get a little bit excited about all the things that we could do with FHIR. I really believe FHIR will change healthcare as much as the smartphone changed the way we communicate with each other. Do you remember these? I had each one of these 15 years ago. They're now pretty much extinct. And now I have one device that takes the place of all of those and gives me more capabilities. This is how we live now. One platform that allows any app of my choice to be on that platform. I envision a future where EHRs are platforms and then can play any FHIR app of the provider's choice. The EHR holds the data, and providers choose the apps that meet their needs. And providers would choose the EHRs based on their needs, and patients will choose providers based on how providers allow them to communicate through apps. So PatientLink is a software development company. We're based in Oklahoma City. We focus on building software to capture data from a variety of sources to improve healthcare, workflows, and outcomes. We are industry experts in this field with thousands of providers across the United States using one of our products. Our latest product is called MyLinks. It's cloud-based, consumer-facing, and mobile responsive. It's an interactive platform which allows patients to download and share their data from all of their healthcare providers. It also links us to 3 important groups: with all of our care providers and our data, with researchers, and with each other. MyLinks has a special significance to me. I helped care for my sister as she was dying from brain cancer. A few years after she died, I had cancer. I had kidney cancer. And I'm glad we caught the cancer in time for me, because now I am a cancer survivor. But during those times, I learned a few things. I learned how helpless it feels to have my data scattered out over a bunch of portals, and hoping that my doctor has all of my data to take good care of me. I wanted to fully understand my condition. I wanted to know how severe my condition was, the possible solutions, and the long-term impact to my life and my family. I understood the desperation of others who frantically search for information about their illness. I also understood the deep need to connect with each other. When I was diagnosed with cancer, I went home, I sat on a sofa, and I thought, I want to connect with another woman in my city who has kidney cancer. But of course, there was no way to do that. And because I've been in health IT for almost 2 decades, I'm fully aware that data is siloed across the industry, and that these silos impact our ability to find cures faster. So this is the purpose of MyLinks: to empower, to educate, and connect us with each other to help researchers find cures faster. We believe that this connection will result in better care for us and for those who come after us. And I'm thrilled to say that we won first place in the ONC's Consumer Health Data Aggregator Challenge. This was a really big deal to us. Now let's look at MyLinks. We built it to be very user-friendly, easy to use on a computer and on a smart device. The first button brings the user to view their health record. The record is viewable all in one glance. And clicking on any section in the health record will allow the user to drill down for more information, where they can add, edit, or delete information to make sure their chart is complete and correct. It's also easy for them to see where each item came from. Data provenance is attached to every item. The second button allows the user to import their medical records from their providers using FHIR. They will be able to choose from FHIR-enabled clinics, and this is where I talked about FHIR endpoints, the importance of that, of us as developers having the ability to connect with all of the healthcare facilities. When the data is returned via the FHIR call, it will be displayed on the right, and existing data will be displayed on the left. Possible duplicates will be highlighted to give the option to the patient to import this or not. We're also pulling full CCDs using FHIR and placing that in a document area, and I will show you that in a little while. The third button presents several methods for the patients to share their information. The first area allows the patient to choose specific items of their record, and they can create a PDF. They can download that, take it with them, or they can send that to somebody else. The second item allows a patient to send a link to someone, and this gives them 24-hour view-only access to the record. This is great for telemedicine, for urgent care, for a variety of other areas. The third item allows the patient to let someone else be their caregiver to help manage their chart. A lot of times people are too sick to really take care of pulling the data. This allows shared access. This area allows, clicking on that allows the user to see who has access to their record and which records they have access to. And removing that access is very easy. Click the button and say unlink. The fourth area allows the user to see their share history, who they shared with, what they shared, and when they shared it. So documents section is one of my favorite areas. It allows the users to add anything that they feel is important that they might want to share. This is where when we receive a CCD from a FHIR call, we place it right here. It's very easy for the users to share that. They simply click on the document and click send. If the users have signed up for direct with MyLinks, they can send these elements straight to a provider or anybody else who has a direct address, but they don't need direct if they want to send to a non-direct address. We also have included journaling because journaling has been shown to have a great impact on health. We provide an easy way for patients to track their progress and put down their thoughts. And we want them to be able to connect to each other. As I said earlier, that's really important. So we have a forum here where people can start discussions, join discussions, to connect with people to help them on their journey. They can also click on an area and learn more about a patient or a user and connect directly with that person, either in a public chat or a private chat. They can connect their devices to MyLinks to allow them to view all of their data in one area. And we also really want to engage researchers because one of the goals, as I said, is that we want to enable researchers to find cures faster. We want to connect patients with researchers. We don't do research, but we want to help researchers. So we have an area where we can quickly locate everybody who has said they want to participate in research, and then there's a filter. You could say, okay, these are all the patients that have a history of this or a family history of this, and there's a lot of different criteria for this, and they can see how many patients are available and broken down in the different slots. And so we provide tools also to allow people to create questionnaires that they can send out to the people who say they want to participate. They can send those questionnaires out and it'll be in their email box, and clicking on the email box they can read the questionnaire. And in this one, this patient has said they would like to participate in breast cancer research, so an email was sent and they're able to click Start Survey, and they come to this. And no, actually they came to the survey that I showed you earlier, but as soon as they finish that survey, the researchers or the people who sent the surveys can immediately see all the information that was completed, because it's all in the same database, so they can see what's going on. So in short, MyLinks empowers patients to own their data, send their data to their full care team, connect with peers for encouragement, and connect with research and share their data. And we have a quote here from this morning with Dr. Don Rucker. He said, "The real part of patient empowerment is that patients own their data. That's the ultimate part of this. Patients can take their data, and take it somewhere else and do with it what they want. He also said, speaking of interoperability, patients getting data into their smartphone is the ultimate in interoperability. So again, I want to say thank you to the FHIR community for building FHIR. I am really, really encouraged about FHIR and what we could do with this in the future. If you have any questions, I would love to contact me. Got 2 email addresses here you can reach me at, and I'm very happy to speak with you. Thank you.